Good morning. Welcome to Anatomy Lectures. This is lecture 4. The objectives of this lecture is to identify the pleurae with their parts and innervation. Second is to identify the bronchi and their divisions. Third is to identify the lobes which is our right and left lung. First, we start with the pleura. The pleura, it is serous sac. It is a closed serous sac. It consists of two layers. The inner layer is named as the visceral pleura. It is in direct contact with the lung tissue. It means that it is adherent to the lung tissue. It enters even into the lung fissures, and we will talk about lung fissures later in this lecture. So the visceral pleura is in direct contact to the tissue of the lung. The outer layer is the parietal pleura. The parietal pleura, it lines the thoracic wall. As you know, thoracic wall, it is lined by endothoracic fascia. The endothoracic fascia is lined by parietal pleura. Between the parietal pleura and visceral pleura, there is a slit-like space. It is named as pleural cavity. In the pleural cavity, there is a small amount of tissue fluid named as pleural fluid. Pleural fluid, it is normally 10 up to 20 ml of this fluid. It is very important that it reduces the friction in this region, reduce the friction between the two layers. So, as I said, the pleura, parietal pleura, we will explain in this lecture. It will be divided into 4 parts according to the position of it. First is the costal pleura, second is the diaphragmatic pleura, mediastinal pleura, and finally the cervical pleura. So, as I said, the two layers are separated from each other by space, which is the pleural cavity that containing a pleural fluid, but they become continuous with each other in one region. They forming like cuff of the pleura in the region of the hilum of the lung. At the region of the hilum of the lung, they become continuous. These two layers become continuous with each other, forming like cuff of the pleura. And this pleural cuff, when it hangs down, as this slide show, forming like loose fold. This loose fold, it is named as pulmonary ligament. This is pulmonary ligament. So what is the benefit of the pulmonary ligament? It facilitates the movement of the pulmonary vessels and large bronchi during different phases of respiration. حتى لا تنطبق structures هاي كلها structures مهمة pulmonary vessels bronchi of the lungs حتى لا تنطبق على بعضها بالinspiration والexpiration. فوجود pulmonary ligament, it will allow the movement, a little movement of the pulmonary vessels and the bronchi in the respiration, whether inspiration or expiration. So let's talk about the parts of the pleura. As I said, the pleura, I'm talking of course about the parietal pleura. Then the cervical pleura, visceral pleura, it is adherent to the lung tissue, but the parietal pleura lining the thoracic cavity, lining the endothoracic fascia of the thoracic wall or thoracic cavity. It is divided into 4 parts according to its position. First is the cervical pleura. It means cervical. It means that it's related to the neck. So it extends up to the neck, line the suprapleural membrane. It is about 1 to 1.5 inch above the medial third of the clavicle. This is the cervical pleura. And clinically, this is very important because any injury in this region, maybe stabbing injury, it can lead to rupture of the pleura and damage to the underlying lung tissue. The second part is the costal pleura. من اسمها costal يعني ribs. So it lines the inner surfaces of the ribs with their costal cartilages and their intercostal spaces, extend to the sternum anteriorly and posteriorly to the sides of the vertebral column. إذن هي كلها line the inner surfaces of the ribs مع الcostal cartilage مع الانتركوستال spaces كلها، وتمتد طبعا anteriorly عندنا للback of the sternum و posteriorly to the sides of the vertebral bodies. كلها اسمها costal pleura. The third part is the diaphragmatic pleura. من اسمها diaphragmatic pleura that it covers the diaphragm. وعندنا final part. The fourth part is the mediastinal pleura that it forms the lateral boundary of the mediastinum. The mediastinal pleura. عندنا الميديستاينم قلنا هو median partition. Laterally, the boundaries they are formed by the mediastinal pleura. What about the innervation? The innervation of the visceral pleura is different from that of the parietal pleura. And how is that? The visceral pleura is supplied by autonomic innervation, autonomic nerve fibers, sympathetic and parasympathetic innervation from the pulmonary plexus. But the parietal pleura is sensitive to pain, temperature, touch, and pressure. So, the costal part supplied by intercostal nerves, the phrenic part, the mediastinal part and diaphragmatic part supplied by phrenic nerve. The peripheral part of the diaphragmatic pleura is supplied by lower 6 intercostal nerves. So, the innervation of the visceral فقط autonomic fibers. But the parietal pleura sensitive pain, temperature كل هاي الأمور. فالcostal part supplied by intercostal nerve. الميديستينال والdiaphragmatic أخذناها in the previous lectures supplied by phrenic nerve. Peripheral part of the diaphragmatic supplied by lower 6 intercostal nerves. And this is all we have for pleura. The bronchi. The trachea, if you remember in the last lecture, we said that the trachea, it will end below at the level of carina, at the level of the sternal angle. If you remember, behind the arch of aorta. It will end by division into right and left principal bronchus. Right and left principal bronchi, two. Right and left one. The right and left main bronchi, they will divided more and they give origin to further divisions of more bronchi. Then these more bronchi will be divided into give origin to several million terminal bronchioles. Terminal bronchioles. These terminal bronchioles, they will give origin to respiratory bronchiole. Each respiratory bronchiole, it will divide to give alveolar ducts, which will end into alveolar sacs. Alveolar sacs are the sites of air-blood exchange. The site of the gaseous exchange, it will occur in the region of the alveolar sacs. إذن تبدأ بالبرونكس bronchial tree تبدأ من البرونكاي right to left main bronchus والبرونكاي more divided into more bronchi. This is a primary, بعدين it will become secondary, tertiary, وهاي tertiary بعدين تقسم تعطي terminal bronchioles والterminal bronchiole يعطي respiratory bronchiole respiratory bronchioles it will divide to give alveolar ducts والalveolar ducts it will end into alveolar sacs which are the size of the gaseous exchange. So the right principal of bronchus is different from the left one. And how is that? The right principal of bronchus, it is wider, shorter, and more vertical than the left one. And it is يعني صورة الحفظ, it is 1 inch in length. The right bronchus, before it enters to the hilum of the right lung, it gives off superior lobar bronchus أو هو نفسه نسمينه arterial bronchus. Okay, this is before it enters to the hilum. يعني هو عندنا right bronchus المفروض إنه it will enter to the hilum of the lung. Just before it enter to the hilum, it will give the superior lobar bronchus أو arterial bronchus, as it is shown in this slide. Then once it enters to the hilum, it will be divided into middle وinferior lobar bronchi. Okay, even superior lobar or epiarterial, this is outside the hilum before it enters the hilum. Then once it enters to the hilum, it will give the middle and inferior lobar bronchi. This is the right one. The left bronchus is narrower, longer, and more horizontal than the right one. And as I said, it is longer, so it is 2 inch. هذاك أول واحد right, it is 1 inch in length. This is 2 inch in length. It passes to the left below the arch of aorta and in front of the esophagus, as this slide shows. So it passes to the left below arch of aorta in front of the esophagus. This left bronchus, when it enters to the hilum, it will divide it into superior lobar bronchus and inferior lobar bronchus. Okay, there is no epiarterial in this side. The superior lobar or epiarterial, this is only in the right side, but in the left side, it will enter to the hilum, then it will divide it into superior and inferior lobar bronchus. The blood supply of the bronchial tree, this is easy. Bronchial tree supplied by bronchial arteries, right? This is very easy. We have 2 left bronchial arteries and 1 right bronchial artery. Okay, 2 left and 1 right bronchial artery. The 2 left bronchial arteries, they arises directly from the descending thoracic aorta. Okay, while the right one, it arises from the upper left bronchial artery, or sometimes from the intercostal arteries. What about the lymphatics of the bronchial tree? All lymphatics of the bronchial tree, they drain to bronchomediastinal lymph trunks. The bronchomediastinal lymph trunks, it will drain in the right side to the right lymphatic duct and on the left side to the thoracic duct. As easy as that. So this is all we have about the bronchial tree. The lungs. The lungs, normally they are soft, spongy, and very elastic. This is during life. This is normal during life, not in the cadaver, sure. In the childhood, they are pinkish in color, but with the aging and in adulthood, because of the air pollution and inhalation of particles and dust particles and other inhalation of the other pollutants in the air, so there are some dark spots that can be recognized on the surface of the lung. This can be seen on the cadaver maybe. The lung, as you see here, it is conical in shape. It has apex base, costal surface, and mediastinal surface. Right? So it has, the apex is a blunt apex. It projects upward into the neck. Right? It is apex. It means apex. As we said, the parietal pleura, the cervical pleura, cervical part of the parietal pleura, it projects about 1.5 inch above the clavicle, above the medial third of the clavicle, right? The lung tissue, here the apex, here the lung. The apex of the lung, it extends about 1 inch above the clavicle. وفوقات هذا النص inch هو مال البرايتال بلورا أو السيرفايكال بلورا. Okay? The base of the lung, sure, it is concave. It sits on the diaphragm, فتكون concave, مقعرة أكثر. الcostal surface is convex. يكون convex, correspond to the concavity of the chest wall. يكون convex. الميدياستينال surface طبعا يكون concave, to be molded to the pericardium. ياخذ شكل البريكارديوم, molded to the pericardium, to the adjacent pericardium and other mediastinal structures. Because the mediastinum, as I said in the previous lectures, it is a median partition. Okay? On the sides, the pleurae and lung, the lungs. And here the mediastinal surface of the lung is molded to the pericardium. See, it has a blunt apex, concave base, costal surface, and mediastinal surface molded to the pericardium and other mediastinal structures. At the middle of on the medial view, let's say, of the lung, there is a depression, as I said, which is named as the hilum, or the root of the lung, or the hilum. It is the site where the bronchus, the vessels, the lymphatics, the nerves, is the site of entry and exit of these structures to the lung tissue and lung parenchyma. The anterior border of the lung, it is thin and it overlaps the heart. And on the left side, there is a cardiac notch. It is found, the cardiac notch. The posterior border, it is thick and just it is beside the vertebral column posteriorly. The right lung is different from the left lung. There are some differences between the right lung and left lung. The right lung, it is larger, slightly, it is larger than the left one. There are two fissures in the right lung. First is the oblique fissure, second is the horizontal fissure. So there is the oblique fissure and horizontal fissure. Two fissures. These two fissures, as you see here, they will divide the lung, the right lung, into three lobes: the upper lobe, middle lobe, and lower lobe. Upper, middle, and lower. Okay? So let's try to understand the extension of these fissures. First is the oblique fissure. The oblique fissure, it runs from the inferior border of the lung. يبدأ منين؟ يبدأ oblique fissure يبدأ من inferior border of the lung. It runs upward and backward across the medial surface and costal surface of the lung until it cuts the posterior border about 2.5 inch below the apex posteriorly. Okay, إذن هذا هو امتداد الأوبليك fissure. This is very important. It runs from the posterior, from inferior border upward and backward, crossing the costal surface, medial and costal surface, and then it ends by cutting the posterior border about 2.5 inch below the apex in the posterior border. So what about the horizontal fissure? It is horizontally across the costal surface, horizontally. At which level? At level of costal cartilages, at the fourth costal cartilages. So it crosses the costal surface horizontally at the level of the fourth costal cartilage. The horizontal fissure meet the oblique fissure. They meet each other where? In the mid-axillary line. The horizontal fissure meet the oblique fissure at the mid-axillary line. So, the middle lobe is a small triangular lobe bounded by horizontal and oblique fissure. This is the middle lobe, as you see in this slide. It is triangular in shape, small. It is bounded between horizontal fissure from above and oblique fissure from below. The root of the right lung has relation to structures that are different from the structures in the left lung. يعني root of the right lung and the relations خاصة, والroot of the left lung and the other relations. Root of the right lung, it has look at this slide. It has relation to the arch of azygous vein from above. Arch of azygous vein are related to the root of the right lung from above, while behind the root runs the azygous vein. The arch from above and the azygous vein from behind. This is the root of the right lung. So what about the left lung? The left lung here, there is no horizontal fissure. No horizontal fissure in the left lung. Only one oblique fissure. ولهذا, that's why it will be divided only into two lobes, upper and lower lobes. There is no middle lobe here. And what about the relation of the root of the left lung? The root of the left lung, as you see, it is left lung. So from above, it related to the arch of aorta. And from behind, it related to the descending thoracic aorta. So the descending thoracic aorta, it descends downward behind the root of the left lung, while the arch of aorta, it crosses above the root of the left lung. And thank you for today.